Welcome to this explainer. The next time you walk into a hospital or a clinic, take a good look around. While the doctors and nurses absolutely get all the credit, and rightly so, there is this whole hidden world of everyday clinical technology that is actively keeping things running safely, day in and day out. So today, we're going on a clinical journey to uncover the hidden engineering that is hiding right in front of our eyes.
I want you to picture this, a super bustling operating room. You've got doctors, nurses, split-second decisions happening all over the place. But let's look past the people for just a second. Without a few brilliant, completely unsung machine heroes working quietly behind the scenes, modern medicine would literally just grind to a halt.
All right, here is our game plan for today's explainer. We're going to dive into 4 main areas: sterilization under pressure, illuminating the surgical site, delivering life-saving oxygen, and finally, precision in medical measurement. Let's start right behind closed doors with Section 1, sterilization under pressure. Now, you might be thinking an autoclave is basically just a giant, really hot oven. Well, not quite. It's actually a high-pressure chamber engineered specifically to stop the spread of deadly infections. You see, regular dry heat just isn't always enough to kill off the absolute toughest, most resistant bacterial endospores that can contaminate surgical instruments. For those stubborn bugs, we absolutely need moist heat. What's actually happening inside one of these things is pretty wild. The hot steam blasts into the chamber, and because of how it's designed, it forcefully displaces the cooler air, pushing it down and right out through the bottom. This super precise circulation pattern is exactly what guarantees that every single instrument inside reaches the critical temperature necessary for total 100% sterilization. And this is where the physics gets absolutely fascinating. Normally, water boils at 100 degrees Celsius, right? But the autoclave uses a completely sealed environment to drastically ramp up the pressure. This forces the water to boil at an incredible 121 degrees Celsius at 15 psi. After holding it there for about 30 minutes, the steam gives off latent heat the moment it touches the instruments, which just completely obliterates those resistant microbes. Finally, the pressure is safely vented through a whistle valve, bringing the chamber right back down to normal room pressure. But, things in the real world do break down. And when they do, clinical techs basically have to play detective. For instance, if those instrument packs are coming out wet and taking forever to dry, the tech instantly knows the bellows likely failed in a closed state, which traps all that excess moisture inside instead of letting it escape. Or, if the machine isn't fully pressurizing, that's a dead giveaway to check the door gasket for leaks. Okay, moving out of the sterile prep zone and into the bright lights of the OR, we hit Section 2, illuminating the surgical site. A surgical light is definitely not just an oversized desk lamp. Think about it. Surgeons need to aim light perfectly without casting weird shadows and without wrestling with incredibly heavy equipment right over an open patient. To pull this off, these lights are actually statically balanced mechanical systems. They rely on this really clever network of rotational joints and spring arms. The whole setup relies on a spindle anchoring it to the ceiling, while rotational joints give it total freedom of movement in the horizontal plane. Meanwhile, there's an internal spring arm providing vertical freedom that perfectly balances the incredibly heavy light head. Seriously, it practically floats in midair, staying exactly where the surgeon leaves it. But gravity is always trying to ruin the party, right? Imagine a heavy lamp slowly drooping out of place in the middle of a delicate surgery. Talk about distracting. Thankfully, a trained clinical technician knows they don't have to replace the whole expensive unit. Usually, they just need to quickly tighten the spring arm's locating screw at the top. This increases the friction and locks the whole thing right back into perfect position. Moving right along to the ultimate challenge of helping a patient breathe. Section 3, delivering life-saving oxygen. We are talking about a literal lifeline here for patients dealing with acute respiratory issues. We rely on heavy cylinders to hold the pressurized gas, sure, but the real magic is the flow meter attached to the top. That little device is what allows doctors to carefully control and dial in the exact delivery rate in liters per minute, making sure the patient gets exactly what was prescribed, no more, no less. Now, hospitals are full of various, sometimes highly dangerous gases, like pure oxygen, nitrous oxide, and carbon dioxide. To prevent a catastrophic mix-up, engineers came up with the pin index safety system. They use specific pin configurations matched with strict color coding, like white and black for oxygen, depending on where you are in the world. These unique pinholes make it physically impossible to accidentally hook up the wrong gas cylinder to a patient's breathing tube. It's just a brilliant, foolproof design. Let's compare 2 totally different solutions for delivering this gas. While an oxygen cylinder holds a finite amount of pressurized gas, meaning it eventually empties and has to be replaced, an oxygen concentrator is a totally different beast. It uses an internal compressor and specialized molecular sieves to continuously pull in regular room air, trap the nitrogen, and pass concentrated oxygen straight to the patient. It's incredible when you think about it. It literally creates a limitless medical supply directly out of thin air. When you're troubleshooting these devices, you gotta be quick and logical. Suspect a cylinder is leaking? Just apply a simple soap and water solution around the O-rings and Bodoc washer. It will instantly reveal dangerous leaks by bubbling up, exactly like checking a bicycle tire for a puncture. For a concentrator, if the humidifier bottle has absolutely no bubbles, you immediately feel around for a kinked or blocked delivery tube. And if there are just a few weak bubbles, you check to make sure the humidifier lid is screwed on tight enough.
All right, for our final stop, we're leaving the trauma units for the super precise world of patient metrics. Section 4, Precision in Medical Measurement.
We really have to make a critical distinction here. Measuring a patient's overall weight on a scale uses completely different engineering than a laboratory balance. A balance is a highly sensitive instrument used to calculate the exact milligram of a pharmaceutical powder. When you are compounding medication, a fraction of a gram could literally be the difference between a cure and a lethal overdose. It is that serious.
Because these balances are so incredibly sensitive, the rules for using them are super strict. First, you have to ensure the machine is perfectly flat by checking the tiny internal spirit level. You hit the tare key to zero out the display. And here is a big one. You must never, ever touch samples with your bare fingers. You always use gloves or forceps. Even the microscopic amount of oil on your skin can completely ruin the perfect accuracy of these instruments. So if a balance starts acting up or throwing erratic readings, it really highlights how delicate this hidden engineering is. It could be something as simple as a few drops of spilled liquid messing with a weighing plate. More seriously, if someone overloads the balance, it can permanently bend the super delicate internal load cell, which basically ruins the machine. Or, hey, if the software is glitching out, you might just need to swap out the dead backup battery for the internal microprocessor. So, we've seen how extreme pressure creates absolute sterility, how springs can perfectly balance heavy surgical lights, how molecular sieves actually capture oxygen from thin air, and how strict protocols guarantee precise life-saving measurements. These hidden systems truly are the silent heartbeat of modern healthcare. So, I leave you with this thought. The very next time you step foot inside a clinic, look just a little bit past the amazing doctors and nurses. Can you spot these silent, life-saving machine heroes operating right under your nose? Keep learning, keep observing, and I'll see you in the next explainer.